Hi, welcome to the Health Data Ethics Podcast. I'm your host, Jenny Owens, here with another episode in our series on the Voices of Innovation AI edition. Alex, do you want to introduce yourself?
Hi, Jenny. My name is Alex Goryachev. It's a pleasure to be with you and with your listeners. I've spent about 25 years in the emerging technology space with about, I want to say, last 5 to 7 years, depending on how you count, in AI. I've led and built Cisco's global innovation centers. I've spent some time in the healthcare industry. Amgen, worked for Dell and many other companies. And what I really focus on is corporate innovation. How and why technology should be built and should it be built.
I am so delighted that we found time to chat today, and I'm really hopeful that this is not the last of our conversations because I cannot tell you how much I enjoyed reading your chapter for Voices of Innovation. Tell me a little bit first about how you got plugged into this community.
Well, at Cisco, when I was running global innovation centers, we've done a lot of work with healthcare and in regulated industry across the world. So it was a natural fit when they reached out to Cisco for me to go and step up. And that's something that I'm really passionate about because at the end of the day, we want to use technology for good versus just shopping and entertainment. And that is a perfect example of how we can use technology.
Yes. So I read your chapter with great interest, and as I was reading through your thoughts on effective AI implementation in healthcare systems, one of my very favorite quotes from one of my very favorite papers kept coming to mind, and it was this quote from Wendy Dean and Simon Talbot and Austin Dean's wonderful article on reframing clinician distress as moral injury and not burnout. Talks about how massive information technology investments, which promise efficiency for caregivers, instead divert capital resources that could be used to hire additional caregivers. They divert the time and attention of those who are engaged in patient care, and sometimes they don't do much to improve patient outcomes. So those who know me know that I quote this paper all the time, and it really came to mind as I was reading your chapter. I wondered if you would dive in for me a little bit into this concept of excess innovation. Because I feel like in our space, we get a lot of excitement about innovation and this concept that innovation is kind of always good. It's nice to hear somebody say, now, wait a minute, let's talk about when we can have too much.
Definitely. I mean, innovation is always, there's always room for innovation. I look around my kitchen and there's so many gadgets and each one of them was sold to me with a promise of giving me my time back. And I look around and it's like, no, all of this is taking a toll on my time. When we think about the social media and all of those things and this wonderful gadget, all of this is in the name of getting us more connected and giving us time back, yet we're probably through this journey of innovation, sometimes we become more disconnected from ourselves. So when I think about the excess innovation, all I want to say is there's the right time and the right place and the right venue and the right team. So, for example, if we're running a hospital or a healthcare provider, do we really want to build our large language models? Do we really want to spin off a large AI development team? And is that the space we want to be innovating in? So I think it's going back to the purpose, and that purpose defines what's success and what's not.
I really resonate very strongly with that. One of the things that I love to think about when we think about any new and innovative technology is who's the intended end user and what are they going to do with this tool or with this information. You spent some time in your article talking about risks and problems for artificial intelligence. You talked about cost efficiency and decision making, maybe opportunity cost and strategic focus. Tell me a little bit more about some of the risks and problems with artificial intelligence.
Well, I think in the world of artificial intelligence, right, there are a lot of risks and we all know them. Whenever that's privacy, data security, there's a lot of those risks, and some of them we're only starting to discover, right? Especially in the regulated space. For example, it's very easy to teach AI something. Or I should say it's far more easier to teach AI to learn something versus make it unlearn it, right? And as you know, in the regulated space, there's a lot of requirements for explainability. Explainable AI is not necessarily something that fully exists today. So there are a lot of risks, but I feel the biggest risk is for us to get too excited about building technology without a clear purpose. And again, if we're in an R&D setting and we have a very clear metric, actually, the answer is very simple. The risk is to get carried away on building technology without a clear metric. I believe that innovation should be pragmatic, and we should begin with a clear metric in mind.
I could not agree more. If you can't measure it, then it's very difficult to accurately assess the impact of your new technology on your organization. Alex, is there anything about innovation that you want to share with people that I have not already asked you about?
Well, I think innovation is a beautiful thing. It's changing the world. It's been changing the world for centuries. I think there's a lot of innovators out there, especially in the healthcare space, because again, it's driven by a desire to help people and help save human lives and make human lives better. For example, I'm a part of a so-called biohacking community, and there's a lot of promise there, and there's a lot of excitement. And I really believe that it's important that we focus, and we focus on something that we can accomplish, that we innovate together as part of the team in the right setting. And it's kind of important in the context of AI, and we know what comes next. For example, with AI, a lot of work is about automation. Well, what's going to happen once those processes are automated? So let's say there's this technology, we're going to automate certain processes. What's going to happen with the people that are currently doing that work? Are there going to be continued employment for them in that space? If no, where would they go? What would they do? How overall processes would change? So I think it's very important that we focus on the context in which technology is going to fit in versus purely technology. Same as a social media example. It's great that all of our kids are connected, but is it? We have countries and jurisdictions and states that are banning social media up to a certain age. And I believe that is a responsible, as a parent and as a human being, I believe that that is the right thing to do. But it took us a decade to learn that. Mm-hmm. So it's important that we look at that context and that we are very careful with the technology that we're developing and putting in other people's hands.
Yeah, I could not agree more, especially as the parent of two children who are aging into their social media era. And I'm just thinking a lot about it. Alex, thank you so much for your time today. It's been such a joy to chat with you. I'm so excited to appear on the author list alongside of you with the Voices of Innovation AI edition, which can be purchased, and all of the proceeds from that do go to support cancer research. Thanks. Appreciate it.
Thank you. Thank you so much for having me here.